GAIA team for caring after orphans here in Matindi. You gave us blankets. Before you came, we were covering ourselves with rags or sacks. You gave us soap. You gave her a beautiful dress, as you can see. Soap, board oil and school material, exercise books and ball pens. She would like GAIA to continue with its activities so that she can continue with their education. She would like to ask the Almighty God.
That was a great clip. So Bill, you started GAIA 12 years ago. So can you tell us what you think are the main accomplishments of the organization in the past 10 years?
Yeah. Todd very nicely summarized the current programs. I think measuring where we are now with respect to where we had been when we started, and focusing for the moment on the Villages program, we got a very nice grant in 2003 from the Bill and Melinda Gates Foundation to build a women's empowerment program in the rural areas of the southern part of Malawi, which is the most highly impacted part of the country, both in terms of abject poverty and also HIV prevalence. And we started out with 25 villages, and we were in each of those and are in each village for a total of 3 years. We hire, train, equip, and deploy 4 to 5 women caregivers per village. And they take care of the orphans and also do the home-based care visits, deliver health messages, and on. And Todd covered that nicely. We went from 25 villages in the beginning to now 137.
Wow.
And I think I said we stay in each village for a total of 3 years. The second program area is the microloan program. We started with 0, and we now have a total of 2,415 women on microloans. And the changes that you see with those women are extraordinary. They tend to be extremely reticent as African women, and then once they get into the program, everything changes, and they really mean business. And they even get their husbands and boyfriends working for them. They're very entrepreneurial. With respect to the mobile health clinics, we got a lot of help from Elizabeth Taylor and her foundation, and they bought the 3 vehicles that we have and also pay for the crews of 4 people each per vehicle, and also the medications, including anti-malarial medications, antibiotics, and the like, and the rapid tests for HIV and for malaria. And I should also add that in the villages, one of the things we do is to distribute anti-malarial bed nets. Malaria happens to be the biggest killer of children under the age of 5. And so we've done a lot, I think, to keep little kids alive. And the nurses now, as Todd said, we have graduated 120 of those nurses who are deployed now to the government district hospitals and rural clinics. And we have 181 still in process. And we recently, by the way, just signed a 5-year grant with USAID to deliver what's called basic emergency obstetrical care and other capabilities to 400 Malawi nurses, among other things. So it's grown tremendously, and I just must say, not least because of the immense generosity of an awful lot of people in the Bay Area.
That's a very impressive track record. So, Todd, as the new president of GAIA, where do you see GAIA going in the next few years, or the direction of the organization?
I remember being asked this question when I was interviewing for the job, and I was afraid how I could answer it and come up with the right answer. I have a much better answer for it now because I've actually visited the programs, and I can say with great certainty that much of what we're doing is exactly right, and I just want to keep doing it. But I want to do more of it, particularly with respect to the mobile clinics. We need more mobile clinics in more districts, serving more villagers who don't have access.
Sure.
In terms of the nurses, the shortage, we're doing 300, we've got the math of the nurse calculations that Bill gave you suggests that we've done 300 nurses. We've supported 300 nurses in school, which is a lot. But there's only 5,000 nurses in the country. So we've added a big chunk, but the shortage is immense. We really need to grow that program. The other thing that I would say, the only thing we're going to do differently is invite others to layer their good works on top of ours. And what we're doing in the Village program is really a platform onto which many other non-governmental organizations can add their particular skill set. They can come in and dig a well. They can come in and do their form of micro savings. They can come in and teach agricultural techniques. But we've laid the groundwork already with the villages. I think that in the future, GAIA is going to bring in other partners to have a greater impact on the same beneficiaries.
Sounds very promising. So all of this and hearing about GAIA's mission and the progress, in some respects, though, it can seem very intimidating. What could an individual do to make a difference or to get involved? Individuals, groups, churches, service clubs, anything like that? Do you have any thoughts on that?
Well, the good news is that GAIA is very lean and mean. While we do have 58 employees, I think 51 of them are in Malawi, and things in Malawi are quite inexpensive, and we can put donations to great use, and they can go a very long way. For example, I think there's up on the screen, there's a variety of the costs to GAIA. And you can see some of the things that we include in an orphan kit is a blanket. That, it's quite affordable. We also do lots and lots of HIV kits, lots and lots of malaria kits. Each of these things require money. All the way up to supporting an entire mobile health clinic in the way the Elizabeth Taylor Foundation does, and all the elements of that clinic. But donations have been what's allowed GAIA to grow to where it is, and individual donations are particularly valuable to us, both because we need the money and because they provide incredible flexibility that we don't have when we get a big institutional grant that has a lot of requirements to it.
Right.
With individual contributions, we're able to react quickly when we see a need and we see an opportunity.
Okay, so there are many different organizations that are focused on relief work, humanitarian efforts, and trying to tackle really difficult issues of poverty. What would you say motivates individuals and institutional supporters of GAIA specifically?
Well, I think there's a couple of things. One is the interfaith angle. And when I was working in Rwanda, one of the most effective groups that I saw was a group of, it was called the Rwandan Interfaith Network Against AIDS. And the most amazing thing about it is that these are groups where religion has almost replaced tribalism, in that's where great animosity exists between the groups. And the religious groups, almost across faiths, have done enormous damage historically with regard to HIV, in terms of promoting the stigma that has surrounded HIV. But with some of these interfaith approaches, where we're getting Pentecostals to sit down next to Muslims and all together agree on some very basic positive messages, such as HIV is a virus. It's not a sin, it's a virus. And those kind of approaches that take advantage of infrastructure that's on the ground and then cross across the faith groups are very, very powerful. And I think that GAIA really benefits from that reality. The other thing is, while we are GAIA, which is global AIDS, the fact that we focus so intensely on Malawi and so intensely on particular areas of Malawi allows us to really have a transformative impact. If we were spread thin, if we took our entire budget and spread it over sub-Saharan Africa, we would do nothing. But we're making a major difference in Mulanje. And by making a difference in Mulanje, we're influencing what's happening in Malawi, and we're influencing what's happening throughout sub-Saharan Africa.
We're tackling one corner of the world at a time, right?
That's the idea.
It's fantastic. So, given what you've heard today, you may want to learn more about GAIA. You may want to support GAIA. You can visit GAIA's website at www.thegaia.org, and you can find information on the website about the various programs that we've heard about today, as well as ways to donate. And also, we're very excited to announce our garden party fundraiser on April 29th. It's going to be held at a private home in Atherton. And there's information on the GAIA website about the program. As you can see here, we have as our keynote speaker Dr. Abraham Verghese, who's a very well-known author of the best-selling novel Cutting for Stone. And also as our MC for the day, Anne Lamott, who's also a very prolific writer. And we're very excited about the event. It's going to be a lovely afternoon, and we would love to have a great turnout of support for the incredible work of this organization. And you too, in the Silicon Valley, can make a difference in the lives of people who are completely desperate and without hope in the far corners of the world, in particular in Malawi. And this is a great organization. We appreciate your support. Thank you. So before we sign off, we're going to leave you with a beautiful short video. It's about a it's a video of a graveyard, and it's a Malawi poem. And Bill is going to tell us a little bit more about that.
This was filmed by a wonderful young woman in Mill Valley, whom we flew over to Malawi with us on one occasion. She spent the night before this video was filmed out in the bush and arose early the next morning with the women. And they are doing what's called over there grave cleaning. It'll give you a sense of an interesting cultural aspect of Malawi, and at the same time, it'll enable you to see a little more poignantly the devastation of HIV and AIDS.
Thank you very much for being with us today and for learning about GAIA and this very important work. Thank you, Bill. Thank you, Todd. We appreciate you being here with us today, and we appreciate your support. Again, if you're interested in learning more about GAIA, you can visit the website at www.thegaia.org. Thank you.
Diende,